Okay, we're live. We're live on Friday night. Not sure why. Alright, so we did a video on Wednesday and I talked a little bit about what happens to the spine the longer you have the problem with inflammation to the disc and to the nerve. And the video tonight sort of ties in with that, because that was all about the inflammatory process and how it makes changes to the nerves and the spinal cord. And there was a research study done, and it wasn't that long ago, a couple years ago, which isn't that long ago, and they identified why some surgeries fail. They identified a variable that when you have it, you're more likely to fail the surgery. So it kind of ties into what we talked about the other day, but I think it's very informative. And part of why I do all this, and I get a lot of feedback, that it is very helpful. The more you understand about your back problem and what causes back pain, the more likely you are not to make it worse, because that does happen. Matter of fact, it happens often. And the more likely you are to get better. Because once you start down this pathway with back pain, you kind of got to be careful. Sometimes you take a left and you should have taken a right. And what that means is it's not a simple problem. Back pain actually, in the beginning, can be a simple problem, and it's simple to fix if you do something about it, but sometimes people don't do anything. And then they go down this pathway where the spine breaks down, the disc breaks down, the joints break down, and you start to have more problems. So this video, all the videos are about that. There's 717 videos, or maybe more. I don't know exactly how many, but there's a lot. And I'm going to start making more. And I'm going to start making more because there's a lot of questions about how to do certain things. Somebody asked me the other day, how do I put on my socks? My back pain hurts too much. So I'm going to make a video about that because every little bit helps. Matter of fact, I made a list of about 200 videos I'm going to make, so we're going to start. But this research study identified one thing, that when you have it, it means trouble for your surgery. This is me here. Illinois Bank Institute is who I work for, work with, and own and operate. This is our disclaimer. If you haven't seen a doctor, go see a doctor. This is not, I'm not treating you. Okay, this is educational purpose. I have a mission. My mission is to eliminate back pain from the planet, and we've made a couple of discoveries recently that is going to allow us to eliminate back pain from the planet, period. It's important. We're going to talk more about some things that we discovered, okay, next week. We discovered them a while ago, but we're going to talk next week. So I want to eliminate back pain from the planet, and we're going to do it through our research and our information, treatment, and knowledge. Now, the two studies that I talked about the other day were about the effect of inflammation has on the disc and the effect of inflammation that has on the nerve as a result of back problems. When you have back pain, there is a level of inflammation. And what happens is your spinal cord becomes sensitized, meaning it's oversensitive, hypersensitive, and you become hypersensitive to motion in the nerves and in the spinal cord. So when you have a serious back problem with a lot of inflammation, what happens is you develop some inflammation in the spinal cord, but you also develop a lot of inflammation in the spinal nerves. And they become hypersensitive. And it's all a result of the breakdown. You know, we've talked about the spine, 24 vertebrae. In between each vertebrae there's a disc. The disc starts to break down. That breakdown of the disc will start to aggravate the nerves. The nerves in the low back go down the leg. That's called sciatica. The nerve gets pinched by the disc pinching it, but also by the inflammation pinching it. And what we talked about is the disc is a jelly donut, in the sense that the outside of the disc, there's a thick material. Inside the disc, there's a jelly. And what happens is that disc can break down. It breaks down from load. It breaks down from mechanical pressure. It breaks down from poor posture. It breaks down from bending wrong. It breaks down from muscles being out of balance, using the wrong muscles. There's a lot of reasons, but when it starts to break down, there's an inflammatory process. The jelly will start to move, and then the outer, thicker portion, the cartilage, starts to tear. That creates inflammation. And then the nucleus very often will push all the way through and start to pinch the nerve. That causes a great deal of inflammation. At this point in time, when the nucleus pinches the nerve gets inflamed. And then the spinal cord actually has an inflammatory process that takes place inside the spinal cord and makes you hypersensitive. I get phone calls. Why do I still have sciatica? Okay, you have sciatica because you still have a little bit of inflammation in the nerve and in the spinal cord. Okay, but you can eliminate that. And by eliminating that, the symptoms go away, which is what we talked about Wednesday. Now, the study today is about what happens with this inflammation and surgery. Okay, we know that when the disc breaks down, it becomes inflamed. You get tearing here, you get tearing on the outside, you get tearing on the inside. This is called delamination. Cartilage is breaking apart. You get little tears on the bottom part. These are called rim lesions. Okay, so what's the study? High sensitive C-reactive protein, which is a marker for the amount of inflammation in your body, is an effective tool for determining post-operative recovery, meaning how much better you're going to get. Okay, here's the study. And what they identified was the higher the C-reactive protein, the level of inflammation in your body as a result of this problem, okay, as a result of the disc, the more inflammation you have, the less likely you are to solve your problem with surgery. The less likely you are to get the benefit from the surgery. Okay, outcome. Outcome is how much improvement you get. The higher the inflammation in your body, the lower the improvement. It's a direct correlation between the amount of inflammation you have in your body and how well you recover from the surgery. I don't mean just recover, but how much better you get. They measured the outcomes. The Oswestry Disability Index, the same thing we measured. Okay, high levels of inflammation, they had less than 10 points improvement. Lower levels of inflammation, they had 15 points, which isn't very much, by the way. Not for all the pain and suffering you have to go through. So they identified this variable. Okay, we have the ability to solve the problem in the disc. We talked about this the other day. When you solve the problem in the disc, the inflammation goes away. Herniated disc gets better with our therapies. Degenerated discs get better with the therapies. It's affecting the disc. We have the ability to affect the disc. We have the ability to decrease the inflammatory process. Pain goes away. Central sensitization goes away. Okay, sciatica goes away. We have that ability, and that's one of the discoveries we made not that long ago, is how to get the inflammation out. We stretch the muscles by using our full body decompression. We do vibration, which helps decrease the inflammation, and we use specialized pro-resolving mediators, which helps eliminate the inflammation. Okay, we did a study, and the study that we did was 1,200 patients that qualified for surgery, so they were surgical candidates. How do we know? Because they had disc problems with nerve problems, and they had high levels of pain. They had it for more than a year. So they were all candidates for surgery that went through our program. 26% of them had gone through surgery before they even saw us, and they didn't get better. Failed surgery. 516 had herniated discs, 885 had degenerated discs, 921 had bulging discs, 907 had sciatica, and 807 had stenosis. Inflammatory process inside the spinal canal, causing the spinal canal to get smaller. So the question is, what effect do we have? All those 1,200 patients that went through the program, they started with a pain of 8.5, and they finished with a pain of less than 1. And they'd had active pain for a year, but they'd had back problems for 7.5 years. 26%, 312, had gone through surgery and failed the surgery. Why did they fail the surgery? They failed the surgery because the disc was broken down and inflamed, and the nerves were inflamed, and they had high levels of inflammation. That's why surgeries fail. They did it. They identified the variable. Do they use it? No. Do surgeons know this? Yes. Do they check your C-reactive protein? Not always. So the key is to eliminate the inflammation and take the pressure off the disc. Decompress the disc, normalize the motion, pain goes away. 1,200 patients. It's in review right now with a major medical journal. I have a mission. My mission is to eliminate back pain from the planet. It can be done. It can be done. Decrease inflammation, which is what we do by taking pressure off the disc. Decrease the inflammation. Reactivate the muscles. Restore normal motion. Get the blood to flow back into the disc. Discs that are compressed break down fast, and that breakdown process is an inflammatory process. Causes inflammation. When you feel like you're stuck, it's because the disc is compressed. We unstuck it, and we get the blood to flow. It happens. Slowly, but it happens. Okay? My goal is to eliminate back pain from the planet, and we do it through our treatments and our teachings. We can do it. I need your help. I need you to like my video. I need you to subscribe to our YouTube page. I want you to share this information. A lot of people have no idea what we do, or they can even get better. You can get better, and ask questions, make comments. Okay, I like to answer the questions. Subscribe to our channel. We have 717 some odd videos, maybe more. I'm going to make more. I made a list of 200. I think I already said that have to get made. But if you live in our area and or in the United States or anywhere on the planet for that matter, because we get patients from all over the whole planet, often, every day, 844-577-7329 is our number. If you have a disc problem, you need to call us. Be aware, if you're getting surgery and you have high levels of inflammation in that disc, there's a good chance you're not going to get better. Study says it right here. Okay, it's in the literature. You need to be aware of that. You need to make educated decisions about your back, because when you don't, it could physically ruin you.